Hello, I'm Pauline Howie. I'm the Chief Executive of the Scottish Ambulance Service and I chair the Scottish Veterans Care Network Oversight Board. So the Mental Health and Wellbeing Action Plan was one of the key recommendations from the Scottish Veterans Commissioner's review of mental health services for veterans in Scotland. The Scottish Government fully accepted all of those recommendations, and when the Scottish Veterans Care Network Oversight Board was established last year, we set out to develop this mental health action plan. So I'm delighted now that it's come to fruition. The action plan really sets out clearly how veterans will be supported by much more tailored mental health and wellbeing services that meet their specific needs. So the action plan has been developed with veterans and with those people who currently provide care services, both in terms of statutory agencies and third sector organisations. And those people, the veterans themselves, their supporters and those organisations and the staff in those organisations have such a wide knowledge and experience of need, and they really want to focus on extending and sharing that knowledge and experience. So the action plan really aims to improve awareness, knowledge and extend training in specific veterans' mental health and wellbeing needs for the future. So one of the key recommendations is that we're going to establish a network of veteran peer support workers. These are people who have been veterans and have made the transition into civilian life. So they are very well experienced, and a lot of evidence and research supports this notion that veterans will feel more supported by those that have been in the same situation as them in terms of moving from military into civilian life, and can really appreciate some of the challenges both from the military experience and making that transition into civilian life. So I think that's a really exciting recommendation, and one that I'm really kind of keen to see how it's implemented. So all health boards and integrated care partnerships are being asked to help make sure that we raise awareness of the action plan and to develop detailed implementation plans across their systems. Now, those will need to be adapted and dynamic and flexible to meet local needs. So, for example, what might be appropriate in a more remote and rural area might not be just as transferable into a city centre local authority, for example. But throughout the last 20 months of the pandemic, I think we've all been learning in terms of working in new ways. Digital technology has played a role. It's not exclusive. There are different ways of working that suit people at different stages, and so we're really keen to make sure that we build the network so that we can share experience and learn from good practice and consider how we might adapt that to suit local circumstances. So the plan has been co-produced by veterans and those who currently provide services. So it has authority and integrity from that perspective. And it's really about ensuring that those that need access to services can do so in a way that's equitable across the country. They can get those services at the right place and the right time, and really enable veterans to live their full potential.